Hello, everyone. Welcome to High Noon with myself, Jennifer Milton, Sarah Gustafson, and we have a special guest today, Zach Klein. Yay, Zach! Thank you so much for being here with us. We're excited to have you, and we're excited to talk about everything that was in the last newsletter. So basically, we're taking what we give in the newsletter and then we're going to talk about it on every Friday at high noon. And we just want to make sure that everybody knows that in the description of this video, there is links to BodhiBuilding Institute. So you can sign up there for free. And the office hours, we can talk about office hours later, but newsletter link is in there. So you can sign up for that for free. There's lots of other great stuff for free. And I'll let you guys take it away.
Oh, you're still muted, Sarah.
Oh, Sarah.
I'm unmuted. Sorry. I was coughing and I didn't want to interrupt my coughing. We're going to talk about the sex differences between male and female, joints, ligaments, all the biomechanics. A lot of this stuff comes from my course, but bringing Zach in, he's a level 4 CHEK practitioner. So he's got all the CP1, 2, 3, 4, the IMS stuff. And so he'll have a lot to add. As I've always stated, it's not really my doctor happy to go into all the biomechanics of things. So he's sort of the expert here on all of that. So we'll start with let's start with the joints and the ligaments. And, talking about how the joint laxity is greater in females, and especially in the knees, elbows, wrists, and spines. Zach, can you sort of talk about why that's important to know in terms of biomechanics and training?
Yeah. So joints are, they're kind of what keep bones together, and they're kind of the foundation of a lot of movement. When you're moving at any point in time, you're moving joints, and keeping those joints stable and balanced long term is what prevents those joints from wearing out prematurely. And for women, having more laxity in their joints, that sets them up, if they're not careful, for long-term issues. So joint pain, joint degeneration, acute joint injury. There's a number of different things that can lead to, given that they're not educated on it, and training properly and keeping a lot of variables in mind when training. So hopefully today we can clear up some questions people might have and help people, especially women, see, okay, when I go to work out, or just when I go to move, what are some things I can take into consideration that are going to keep me healthy? So if I have back pain or something like that, I can use some of these tools to help that go away and maybe stay away for as long as possible.
And prevent it too. I think preventing it is really, really important as well. I mean, I'm sitting here right now we've theorized. You've worked on my shoulder quite a bit, and it felt good for a few hours. But then, coming back, I've got, we think, a theory of tendonitis of some sort. It is important to know, because I have a theory again of like how this developed over a 4 month period of time, is because I going out in the yard, working on the land, clearing things, getting debris. I know that Alex is busy, so I'm just going to get it done. I'm going to do this for him, but not being able to leave a project unfinished, that's my brain and how it works. I'm like, I'll just do it myself, even though it's heavier than what I can really physically do, and a movement that I can't perform with good posture. The stubbornness in me is like, I'll just force it, and so it's really important to think about these things. Like, there's a lot of women that we want to discharge our energy and work out and build muscle, which is really important, especially as you're getting older. You want to protect the bones with your muscles, but we got to be smart about it, because if we just move the way everybody's moving without any consideration, we're going to get injured. And so yeah, women are far more likely to experience chronic pain and injury, joint inflammation than men. Women are, I believe, 8 times more likely to have an ACL tear than men, which I think we'll get down to that later, because I know, Zach, you work on a lot of those types of clients. You know a lot about that. But I just want to show you here. I've shown this before, but I really want to point this out. It's very, very important. It wasn't until 1993 that the United States Congress mandated the NIH to include women in their research. It was mandated in 1993. Now, move along the timeline. It wasn't until 2016 that the NIH actually did it. And it wasn't like we are including women. It's they actually began to implement what Congress told them to do in 1993. So it was 13 years later. So not since, it's been since 2016 when we started to see a greater increase in female participants in research and studies and preclinical trials, which is really important. What that's telling us is that we're only working on maybe 10 years of starting to understand this stuff. When I wrote my course in 2016, women accounted for 3% of all exercise science research. And I think we're up to 6% now. Woo! So this is why it's really important to understand. We're still like in kindergarten when it comes to understanding the differences here. And what we are learning and beginning to understand is why it's important to understand. I don't want to sound redundant, but just putting that out there, this is really important. And so not only are our musculoskeletal structures different, we have greater laxity in our joints, but also our joint surfaces are smaller in women. Look at the differences. This is a pretty good and accurate image. So if you look at the male versus the female knees, look at the joint surfaces there. Women have far smaller joint surfaces there. When you add in greater laxity, that means that women require more neuromuscular control to stabilize themselves through certain movements. And so what would that look like, Zach, in terms of like, okay, so we have longer torsos, we have more narrow shoulders, and with that, a lot of muscle inequality from the top and lower torso. And then, you know, the differences in our pelvis, in fact, kind of influences the way that we move, how our joints move, and sort of the function of the joints in movement. And so when we have that kind of, here's a good photo, difference in the length of our torsos and the shape of our pelvis, as well as smaller joint surfaces, how does that affect how women move differently than men and requiring them more neuromuscular training in order to stabilize their bodies? How would you prescribe that, so to speak?
Yeah, so a couple things there. I mean, so men are basically set up to handle heavy duty load a lot more than women are. You know, you mentioned more, you know, more muscle mass, obviously, more muscle
and
mass.
this is not sexist. I just want to interrupt. This is not a sexist comment. This is just facts. All right, carry on.
Yeah. So like just men having more muscle mass in general, you know, the muscles are what move bones, but they're also what support bones and joints. And having less muscle mass is much more, you know, likely to lead you to have less, you know, stability in your joints, which we talked about earlier, having, you know, can lead to more issues. And then biomechanically speaking, you know, there's several differences between men and women, especially in the hips and the knees. For example, like women usually have a higher, what's called a Q angle. So the angle that the femurs come in from the pelvis, and that can lead to more stress on the knees, which is probably why women have much higher rates of ACL tears, because that change in that angle at the hip is going to make the knee much harder to stabilize. And so those those things combined kind of set women up to have less, leverage. If we think of like geometry and angles, if you have less muscle mass and you have less dense bones, less, I guess, certain biomechanical angles that make it harder to have proper leverage, that can set women up, especially for when they, for problems down the road, especially when they try to compete with men in terms of uh, uh, following an exercise program or like a protocol that's only really been keeping men in mind the whole time. Um,
Mm-hmm.
so, for example, like you might have a CrossFit class and uh, you'll have men in the CrossFit class running the CrossFit class, and they have exercises that are, designed to, really challenge people. And then, you can usually choose the weight that you use. So women will typically start with smaller weights, but the intensity of it, the exercise selection, and then just, usually a CrossFit coach is not going to keep in mind, where a woman's at in her menstrual cycle, what kind of stress she has going on at home, what kind of diet she has, a number of other stressors. So, you're basically, everyone's got the same program. So when you throw a woman into a situation like that, yeah, they might, lower the weight, for themselves, but all those other factors are going to lead to, a woman, if they're not careful, um, to potentially, run into injuries and things like that. So it's, it's really, really critical when designing programs like that for, for all those things to be taken into account, which is why, having a holistic perspective and being able to look at all those things is going to make it much more likely that you're going to end up with success long term uh, with a woman client or a female client than you would, trying to slap the same program you would a man for a woman.
Yeah, and you brought up CrossFit too, which I think is really important. Anytime you're working with dumbbells, kettlebells, barbells, plates, all of the equipment is actually designed based on the average male measurements. And so just the average male hand span is 8.5 inches, whereas the female average hand span is 7 inches. So if we're working with equipment that is designed by average male measurements, we have to, like, the grip is going to be, we're going to have to open the grip, which is going to recruit our joints and our muscles differently. And then the length of the barbells are based on the average wingspan and shoulder girdle male. And so ours are more narrow. So then when we have a longer barbell and we have to recruit a lot more neuromuscular control on top of what we already have to do in order to lift those bars, hold those bars, and balance them side to side. And so with our longer torsos, that means we have longer muscles, but also in equal distribution from the top and the lower torso. So it's requiring greater, deeper core muscle activation and neuromotor control to be able to do that. And so those are things that when women join a gym or join a training class or get a trainer, that's not really spoken about or considered up front. On average, it's just not something they talk about, which is why I wrote my course. And we have to look at those differences, just like even hand span and wingspan makes a huge difference. Just in volleyball, the average spike speed for a female is 55 miles per hour, whereas a man, it's anywhere between 70 to 80 miles an hour. And that has everything to do with their hand span and their wingspan, being able to generate more force on top of greater upper body strength, not only muscle size and bone size, but women tend to have, on average, 30% smaller tonic muscle fiber composition and 50% smaller phasic muscle fiber composition. So can we talk about that, the differences in phasic and tonic?
Yeah, it's it can get very complicated when you start studying different muscles, and memorizing which muscles are more tonic and more phasic. If you're not into the exercise science stuff, it can be a little overwhelming. So I'll try to make it fairly simple. Every muscle in your body has different roles, and a tonic muscle, tonic basically just means stabilizing. So its role is to stabilize. Phasic, its role is basically just to move. So when you think of, okay, I'm going to, if I'm thinking about a shoulder, the tonic muscles in my shoulder are going to help stabilize that joint so it doesn't move all over the place. And then the phasic muscles are going to be the ones that are responsible for moving the joint as a whole. So they work in tandem with each other. And every muscle in your body, this is kind of a misnomer, which is why it can get complicated, is because people try to remember, which muscles are tonic and which muscles are phasic, when really the reality is every muscle in your body has both tonic and phasic fibers in them. So all muscles serve roles of stabilizing and moving. The biggest difference is certain muscles have much higher levels of phasic fibers than they do tonic fibers. So, for example, the subscapularis in your shoulder has more tonic fibers because its role is to keep your humerus attached to your scapula, so it has a lot of stabilization fibers. Whereas your pec major is much bigger, and it helps to move your whole entire shoulder girdle, so it has much more phasic fibers in it.
And that's really, I want to pause there, because you're talking about the shoulder. Now, this is another difference between men and women. Women have breasts, and we tend to, again, on average, the most common postural dysfunctions are kyphosis due to the difference in the shape of our pelvis and the breasts. So we carry more in the front, and our shoulders tend to go in. And as women who are like carrying babies and like leaning over a lot, sitting in chairs, you're working at a desk, like that comes in like this. And so what that does is it shortens those pec muscles and it brings the shoulder forward. And so one of the muscles I stretch the most are my pecs, even though I am a member of the itty bitty titty committee. So I'm not really worried about like my breasts weighing me down. But just as a mother who's had 3 babies, breastfed 3 babies, and I do sit at a desk, for long periods of time, at least a few times a week, I do have that tendency, and I'm very, very aware of it. So I cannot even imagine. I see women, I have friends with very, very large breasts, beautiful breasts, but I just can't imagine how much that brings your body forward, not only into ketosis, but now these muscles are shortening. You don't have as much stability on the shoulders. So if you're in this posture and you go into a weightlifting class or a dumbbell class or start working with weights with that, talk about how that can create instability in those joints, because knee, ankle, and shoulder are, as well as spinal injuries, are the top injuries in women.
Yeah. So what's the question specifically, just so I know what?
So that postural differences between men and women do have more tendency to lean towards kyphosis or kyphotic posture with that turned in. And so if we're not looking at that, and then that can also bring you a forward head, this forward head angle here. So if you're like this, and I'm exaggerating it, but any posture that is moving you this way, if that's not being corrected, we're antagonizing, correct me if I'm wrong, not only the way you should move in a generalized corrective way, the proper mechanics of movement, but we're compounding that on top of creating the differences between male and female to be a disadvantage, rather than focusing on correcting and making it advantageous.
Okay, yeah, I see. Yeah. So I mean, so think of like what your body does is usually what it becomes. So if you're tending to do things in front of you, your body will adapt to whatever it is that you're doing. So like think about like somebody who's a car driver and they just drive all the time. Chances are their hip flexors are going to be really shortened, and that's just because the body adapts to what you do. And for women, you talked about having 30% less tonic fibers, 30 to
Hmm.
50% less phasic fibers, whereas men have just more muscle mass and more fiber density in general. Um, for if a woman, uh, depending on what she's doing and what her body's adapting to, that lack of fibers is going to make it a lot more difficult for somebody to, be more upright. So, like for example, if you took like a man and a woman and put them next to each other in an office, and they're both sitting in kyphosis all day, so like the rounded shoulders, um, a man's going to be a lot better at correcting those kinds of things simply because they have more muscle mass. They can activate their erectors, they can activate their rhomboids, and correct things. And when they exercise, uh, I don't know the full data on this, but I would imagine uh, they adapt quicker in exercise because of that difference in muscle mass. Whereas a woman has to, their neurons have to do a lot more work to get things firing. So
Yeah.
take into account those biomechanical things we talked about earlier with more narrow shoulders, more narrow hips, femurs dropping in a little bit more. Um, if you think about men having wider joint structures like that, the more base of support you have, the more you can move. The stronger of a foundation you have. And with women, it being narrow, they have less of a base of support, so they're not going to be able to. It takes a lot more. It's a lot more challenging to uh, move things in general. So combining all that, going back to the example of the man and the woman next to each other, um, for a woman's probably going to notice more difficulty with an imbalance like that than a man is, simply because of all those factors I just mentioned. A man can turn those muscles on, and this is just a generalization because there are badass chicks out there that have strong erectors and rhomboids, and they can turn things on. And but just talking of generalization, um, yeah. So those factors combined, like a woman may feel neck pain or shoulder pain from sitting at an office before a man can, just because there's just generally more laxity, less muscle density, and a man can be over there. He might eventually feel it, and
Hmm.
but I would put my money on the woman noticing symptoms before the man, simply just because of those factors. And we can talk
Yeah,
about
they did a study
how
on that actually. It's
to prevent
10 years ago or so about pianists, so male and female pianists. And the female pianists developed arthritis, I believe, at an 80% higher rate quicker before male pianists. So they were actually doing a study on arthritis and different joints where arthritis shows up. And for professional pianists, that's what they do all day. The women on average began to show the inflammation and the pain in those joints and in those bones far before the men did. Usually the men started to develop that in their elbow before they felt anything in their fingers.
Yeah, and this is like a little bit of a side point, but I remember you talking about in your course, women, the cortisol spike that happens under stress lasts
Hmm.
a lot longer than men's. So if you're putting your body under stress, chances are a woman's going to feel that stress and not be able to recover from that stress as quickly as a man can. So, like, if you're playing piano all day, you're putting stress in your fingers and the joints and ligaments and all these things. Uh, you know, if you have a man and a woman with the same level of stress, they're playing the same songs next to each other every day.
Hmm.
A woman's not going to be able to recover from that stress. The stress signal is going to stay around longer, and then combine that with all the factors we just mentioned. The laxity, less muscle density, smaller ligaments, things like that. Yeah, you're giving women a recipe if they're given that they're doing the exact same thing as men to uh, not last as long in terms of just durability of joints and tissues and having pain symptoms like that.
Yeah, so the stability is really it's so I'll start out first, like as we were talking about the joint surfaces and stability, I have my cups here that I've been using on my shoulder. I was like, oh, I have a small one. So women's joints being smaller, this is like what we're working with. Now imagine this is a woman's kneecap. She, a male will have similar same size joints, so like, not much to balance, but your women's joints are much smaller, so they're always recruiting neuromuscular motor control just to stabilize their body. So if she's trying to stabilize on her knees, she's recruiting erector spine muscles, lower abdominal, deep core abdominal muscles, the you know what's the one on the left side? I can't, and it's not the serratus, it's the QL, the quadratus, the QL one on the side. So you're like recruiting so many muscles just to stabilize on a shorter, smaller joint surface than a man has to. So you kind of, again, this is not misogynistic, this is not sexist, these are just facts. Like we can't, if you have eyeballs, then you can see it if you look. But women have to recruit more just to stabilize, just to move, and just to function different things like the keyboards and pianos and barbells, everything. Again, stairs. Everything is designed based on average male measurements. So we're already recruiting more, but that's normal, it's average, it's common. So we kind of adapt to using more and recruiting more. And again, as Zach pointed out, on the left side, you see this is 24 hours of cortisol release in women after a stimulus, something like a stressful stimulus. And that stressful stimulus can be anything from psychological stress, emotional stress, to just actual exercise, physical stress. And on the right is the cortisol release in men. So, if you look at the number between 1 and 3 on the right side of each image, like women are still shooting up into the hundreds, after 24 hours, whereas men are kind of, in the 20s. And so we do experience higher levels of cortisol release, but also because men have higher levels of testosterone, which supports muscle recovery, muscle recruitment, endurance, pain perception. So men can withstand and have greater muscle endurance, as well as recovery, as well as pain tolerance. So again, women are going to notice it a lot sooner than men. And I just wanted to point that out because it's not just that we are different structurally or anatomically. Hormones play a big role in that. And so you sent me your notes too, and you brought up female hormones are going to sort of tell the story or narrate what the pain or injury is, why that's happening for women. It's not just because we have smaller joint surfaces. You can train a woman or program certain exercises that are perfect for her, what she's needing, but then hormones play a part, stress, cortisol, all those things play a part, different changes in our bodies before puberty, after puberty, during and after pregnancy, and then even moving into pre-menopause and menopause are anatomy changes, our bone structures change, so there's so many factors that play into why it's so important to understand these things, because again, it's just not the anatomical differences. Kind of moving into the hormonal influences, we'll do that in a second, but just like as a review, these are the joint differences. Men have in general lower joint laxity, whereas women have greater joint laxity, especially in the knees and elbows, which again, that's why women have 8 times more ACL injuries. The hormones do play are a factor in that because women have higher levels of estrogen and relaxin, which does create even more laxity, flexibility in the joints and ligaments. Women have, again, less stiffness in the ligaments. So you'll see women with tendonitis, torn ligaments, and inflammation there at higher rates. And then, of course, pregnancy. Pregnancy, the relaxin hormone increases significantly during pregnancies in order to allow our bodies to grow, in order to allow the rib cage to expand, in order to allow the spine to lengthen and the pelvis to widen. That joint laxity, that's by design. It just flows and increases during pregnancy. Otherwise, we wouldn't be able to carry a child. So our muscles and our bones are spreading. And then after that, it's like, if you've ever seen a pregnant woman in the side with her belly, the belly's out here. So it forces you to do this. Your ribs open, your stomach lengthens, your pelvis widens, and the spine just starts to go outward, because if it doesn't, with a big belly, you're just going to fall forward. So the spine has to come out, but it also has to lengthen as well. And so after childbirth, that's your posture, and you have to be able to bring it back in a very intelligent and mindful way before they are like, yeah, 6 weeks, go back to boot camp. I mean, like, it's wild. It's absolutely wild. We get, I think it's like 10 times more pain medications, rehabilitation, and time off for an arthroscopic knee surgery than women get for childbirth. It's bananas. That's a whole other thing I just go on a rant for. So I'm just going to move on. But then we have the muscles. We talked about phasic, tonic. And so, Zach, I might ask you to kind of move into like the recruitment strategy as well before we get into the core, which is also really, really important. Women do favor endurance and stabilization because we have higher levels of estrogen, and estrogen does favor muscle endurance, and it does, favor, explosive type strength. It does do that, but remember, the average menstruating woman, her estrogen here seen in red is going to be the highest mid-cycle, and you'll get a little teeny bump right at the end of like the beginning of your luteal phase. So this is an average like 29 days. So like around 19 to 24, you'll get a little bump of estrogen. But really, when we're talking about explosive movements and muscle endurance, that's going to be the days after your menstruation up until around day 15 when estrogen tanks. So when we talk about, estrogen does favor explosive movements, that doesn't mean you can do it every day all the time. There are two maybe key areas of a menstruating woman's cycle where she can really take advantage of that. But if you're on your period, several studies have been done on this now, but this is the study that I used in my course that showed that lumbopelvic motor control is significantly decreased during menstruation. So you can see here, it's at 100% pre-ovulation. That's because, again, your estrogen is spiking. And that's also around the time that in women, testosterone, shown in yellow, begins to elevate a little bit too. So you've got testosterone elevation and a spike in estrogen. That's going to be a great time for explosive movements and for muscle endurance to really go at it with your training. And you're going to get way more out of it if you focus on those days. But if you focus on, say, menstruation, look at the far right, your lumbopelvic motor control is out of whack, and that means what you're trying to do is stabilize every muscle in your body with only 50% of your neuromuscular motor control available, and more specifically in the lumbopelvic area, because here, what is right here? This is your uterus, and when you're menstruating, your uterus is inflamed, and it's sort of, what's that called, Zach, when it refers from away from the tissue and the muscles. So when an organ such as the uterus is inflamed and lots happening there, it's going to, the muscles around it are going to get less circulation, less blood cells circulation, all of that. So those muscles are not going to be as turned on here during menstruation. I forget, what is that called?
It's called a viscerosomatic reflex.
Thank you. See, so nerd. I wouldn't have not remembered that, but yeah. So visceral.
So viscero organ, somatic body. You can also call it a visceromuscular reflex.
Visceromuscular reflex. That's so much easier.
Specifically, yeah.
A VMR.
Yeah.
So that organ or that tissue is pulling from the muscle, which means that muscle's not activating. And that's really important for women because we have longer torsos, therefore longer abdominal core muscles, and we are not training them the way we should. So women, everybody pretty much has weak lower abdominals, but women even more so because they're much longer. And so if we're not training the lower abdominals and we're, during menstruation trying to do box jumps on top of, you look at this in the far left, that's during menstruation, all your hormones are at an all-time low. And so you don't have, the quicker neuromuscular reaction times that men, because they're men, again, not sexist, but they have it because they've got testosterone, and they don't do this. They don't have cycles. Their testosterone is their testosterone. So that's why they have quicker reaction times. We depend on certain times in our cycles to achieve quicker reaction times. So if we're doing box jumps in, week 1 of our cycle, you're going to end up probably with a lot of bloody knees. So just careful with that. Don't use that big box. You make it lower. If you really love doing jumps, lower it down. If you want to take advantage of your uniqueness as a woman, train based on those things, knowing what you know about your joints, about your muscles, your ligaments, but also what you know about your hormone cycle. Because if you're trying to do late follicular, early luteal exercises in your early follicular, you're gonna, excuse my language, you're gonna fuck yourself up long term. By the time you get to luteal, you're not going to be able to do those exercises. Now you wasted a whole month of training. So you're setting yourself back. It's really all about attacking those advantageous exercises during those times your hormones peak and can support it. You're going to get quicker muscle hypertrophy, growth. Your fitness is just going to improve and be able to be sustained long term. At greater levels, more optimal levels, if you pay attention to that, if you're a menstruating woman. So Zach was bringing it up to me too in our notes, we should talk about the core. Yeah, of course we should talk about the core. That is important, I think, because again, we look at the core. Next week, we're going to talk about breathing, so we're going to be talking about the core a lot, but 95% of our organs are in the core. So, albeit, the brain and, but everything else is in the core. So if you are not healthy, something's going on. Kidneys, like I said earlier, the uterus, maybe your liver, pancreas, anything like that. If something's going on, that's going to affect the muscles of the core. But also, what's in there is your guts, your digestion. So, Zach, can you talk about that a little bit?
Yeah, for sure. Like, there's that picture that you showed earlier of the man and the woman next to each other and including their organs. Uh, yeah, that gives you a really good shot of how much space in your torso is taken up by organs versus muscles. So, like, even though men have, the guy on the left has, he's got, thicker obliques, thicker lats, that kind of thing. Um, the organs take up most of the space. Your abdominal wall, uh, it's can get pretty thick if you develop it, but it's not nearly as thick as the amount of space that the organs take up. And another point to consider is your organs are way more important for survival than your muscles are. So if I chop off your bicep, you can still survive and do and walk around and do things. But if I take part of your liver out or your whole liver out, like, you'll be dead in no time. So the body's going to prioritize the health of your organs and glands way more than it's going to prioritize your muscles. So back to what you were talking about earlier with viscerosomatic reflex or visceromuscular reflex, your nervous system is going to prioritize, like, everything in your body is going to prioritize your organs. So if you have stress in your organs, it's going to shunt resources, blood flow away from muscles. And that's important because stress in organs is going to supersede your muscles' ability to function. And if your muscles don't function right, then your joints won't function as well. So stress to an organ is going to increase the likelihood long term of stress to a joint, because a joint's not nearly as important as an organ.
So it's like, okay, so the joints need the muscles to stabilize, and the muscles need the organs to work at optimal levels. And if the organs are not working at optimal levels, the muscles aren't working at optimal levels, which means the joints are not being stabilized, and the joints are more vulnerable and weak to injury and inflammation. Is that right?
Yeah, 100%.
Okay.
Think of, and viewers might not be familiar with this, but the Czech totem pole describes it perfectly. So the stuff that's the most neurologically important for your survival is always going to supersede things that are less neurologically important. Your joints are actually at the bottom of the totem pole in terms of survival. Like, you can break bones, you can dislocate joints, you can really jack your whole body up and still survive just fine. But if I take your hearing away, if I take your vision away, if I take away your ability to breathe or eat food away, it doesn't matter how good of in shape you are. It doesn't matter how good your joints are. You can have the healthiest, strongest joints in the world, and it's going to make it a heck of a lot harder to live um, with those things taken away. So, to the degree that you have stress in your survival mechanisms, it's going to have a downstream effect towards everything else. So, if I hit you in the eye and you can't see through one eye, Jen and I were talking about this earlier, and you can only see through one eye, chances are you're going to turn your head to look through the good eye all the time. Neurologically, your whole body thinks, okay, I'm rotating my head to the right to look through my left eye. Your whole body's going to think, okay, we have to go to the right, and it's going to change everything.
It seems like there's a possible internet disruption with these two. I'm not sure if they're on the same network.
No, we're here. Like, we're,
You're
yeah.
there?
Yep, yeah, I can
Sorry,
hear
guys.
Sam.
Okay.
Just
Yeah, there you
adding to
go.
Zach's totem pole, I decided to upload it here real quick so you can see. Is
Perfect.
like what he's talking about is, the organs are going to really determine what's going on downward.
Hmm. And it does work going up as well. It does work both ways, but it's pretty rare, like, to see. You'd have to have some pretty intense issues going on at the bottom to have it affect the top.
Hmm.
For the most part, it works a lot more downstream, just because it's just more neurologically important, the stuff at the top versus the bottom.
Yeah. So breathing is like, that's why it's up at the top. Like,
Hmm.
without breathing, then you die.
Yeah.
And again, we're going to have we're going to go really deep into that next week. And that's going to be a really interesting one because I'm already putting all my notes together. So you should definitely check that out. If you're watching this replay, go look in our live videos and look for that breathing video. It's going to be awesome. But
I just wanted to say quickly, sorry, Sarah, that it's going to be a series. We're doing a series on the Simple 7. So it's going to be a breakdown of every category in the Simple 7. So it's really important to kind of have them individually, but to also look at them through the lens of a holistic perspective.
Yeah, absolutely. So if you're not on the newsletter list and you're not following that, definitely get on there. You get way, way more information. I mean, it's free. Love to do it, love to share it. But we were talking about, so going into breathing, but also the core and the inflammation. If you're not breathing correctly, you are creating a stress response, which then starts to add inflammation in the gut. So breathing's just one thing that can affect inflammation of the small and large intestine. And this is important to know because, as Zach was just saying, if you have inflammation in the gut or any of the organs in your torso, you're going to have very poor muscle recruitment to stabilize, which a lot of that's coming in from the core. And if your core is weak and you're doing heavy squats or overhead, cleans, hangs, dumbbell, ouch, that's my bad shoulder. Yeah, if you're trying to recruit and pull things up or anything overhead and you don't have the stability of the core because you ate like shit last night, or you depend on, taking like just guzzling down supplements and protein powders, and your guts are just like, oh my God. And then add in you're on your period, which means, again, all the hormones go down. And estrogen and progesterone, who work in harmony to support digestion, mineral absorption, nutrient absorption, those are during menstruation. And that's why a lot of women get sick during menstruation, because their immune system is tanked. So their inflammatory response is not working as it normally does or should. So, what are some common things, Zach, that you see in terms of just like digestion wise that creates this inflammation of the guts, and how that plays out? Like low back pain, I imagine, is one of them.
Yeah, for sure. Low back pain is like one of the most common problems that people have, at least in today's society. People tend to sit a lot, but that it's also the food that we have nowadays is the quality of it is much worse than it was 150 years ago, when people invented pesticides and different farming techniques. It kind of made the quality of the food overall go down. And for example, like the common one to think about is bread. So if you eat bread in America and then go over to Italy and eat bread from there, you'll see that people usually don't have any symptoms from the bread in Europe than they do in America. And that's simply just from the way it's grown, the way it's processed, et cetera, et cetera. And then we also have like hundreds, if not thousands, more food additives that are allowed only in the United States than the rest of the world. Like there's a number of food dyes that just got banned recently that have been illegal, like in other parts of the world for a long time. So America in particular is kind of catching up with the rest of the world in terms of the quality of food. And most people, it's getting better. More and more people are hearing about this kind of stuff, but it's still very common. You walk into your average grocery store and you look at the labels on things, and there's the number of additives and preservatives and all kinds of stuff that's in your food that your body doesn't recognize because it's designed to eat real stuff from the earth versus synthetic stuff. So the more of that stuff that comes in, the more your body has a response to it that makes it irritated. So for example, like people that are gluten intolerant in America can go to, I said before, they can go to Europe and eat gluten and be fine.
Yeah, I have a client who, back in 2012, I've looked at, because I have celiac disease. I was diagnosed in 2001, so 24 years ago. So like I've been learning about gluten for, over 2 decades, but I remember having a client in 2012. She owned, her and her husband owned an Italian restaurant chain in America, but they also had wineries in Italy. So every summer they'd go to Italy. But when she was suffering a lot of like arthritic type of joint inflammation and pain when we were working together, again, I started noticing this more often in my female clients than in men. So like the you know the birth of creating my course started with that, with my early days of bodybuilding and training women. And I started noticing more of these inflammation, IBS, stomach issues, back pain, knee pain, arthritic, joint inflammation, sick days. Like, I'm not seeing this in the male clients, but so I had her take an ALCAT test, and she showed high levels of a allergy. It's like it was on a scale of 1 to 4, and she was a 4 with gluten. And so she cut out all gluten. All her joint pain went away, all the inflammation went away, and she lost 20 pounds in like 2 months. And so that goes to show that like it's not easy for women to lose like fat as it is men. Again, testosterone, average basal metabolic rate in men is much higher, all of that. So 20 pounds in 2 months, a lot of that was inflammation just from removing gluten. Well, she went to Italy and she came back and she was like, don't be mad at me, okay? Like, so we're Italians and we love our bread, we love our pasta. She was like, but Sarah, I was there for 4 months. Like, I never once had any digestive pain. My joints didn't hurt. Like, what's going on? And then that's when I started looking into like, okay, how are we making gluten in America that's different in Italy? Because the differences were just so vast. She came back from Italy to America late August, and she thought, well, oh, I must have cleaned my system because I didn't have any problem eating gluten in Italy. So she came back here. Of course, they have Italian restaurants. She was eating it regularly like she was in Italy, and immediately the pain, the inflammation, and the weight piled on. So it's not just like we're gluten tards who just want to complain like gluten free. Like, it's a serious thing. And since 2012, I've been really looking into that, not just because of celiac disease, but because of the intolerances I was seeing in clients. And there was a Joe Rogan clip from one of his shows last week that went viral about him talking about gluten. And so that's one of them. But what are some other things that cause inflammation in the gut, again, that are going to affect joint stabilization, pain, inflammation, muscle injury, and things like that?
Yeah. So, besides dietary stuff, it's going to be breathing and stress are the two biggest ones. Breathing, stress, and posture, I'd say. So, um, stress, for example, your body can't determine or differentiate between different kinds of stress. So if I'm really cold, um, it's going to feel a certain way, but my nervous system and my brain and my whole body doesn't differentiate that between if I'm really hot. So like even though the experience is different, the stress response that you get from it, it varies, scientifically, but it to your nervous system, it's the same thing essentially. So if you have any kind of stress, whether it be emotional, mental, physical, like even spiritual stress, um, your body is going to uh, essentially conglomerate that those stresses into one pool, which is your existence. And the higher levels of stress that you have, yeah, Sarah's got a good chart up here. Chemical stress, electromagnetic stress, nutritional stress. I mentioned thermal stress. All those things, they come together, and your organs are going to feel it. So um, there's a really good comparison in Chinese medicine between emotions and different organs. So, for example, like the stomach and anxiety are paired together, and the liver and anger are paired together. So there's that saying, I have butterflies in my stomach, and it kind of means I'm anxious about something. Well, there's a reason those two things correlate.
Is
Because
that me cutting out, or is that you guys?
You.
Okay.
Yeah, that's right. Yeah, butterflies in your stomach. That's a good. It's good to point that out too, because anxiety, nervousness, fear, and also the feelings of creativity and excitement. Those are all in the stomach. So butterflies could be like, oh, I'm scared, or it could also be like, oh, I just met this hot guy.
anticipation, yeah,
Yeah.
excitement, yeah, yeah, for sure. Yeah,
Yeah, I'm glad you brought that up, because I mean that wasn't in the notes. It's like, yeah, we do carry our emotions, and a lot of people will hear that and be like, that's so woo woo, but it's true. Like, you get angry, but you learned that it's not appropriate, or the good thing to do to express your anger, and you suppress it. Like, where does the anger go? It doesn't just disappear. Like, emotions are part of our sensory system that also promote movement. So we talked about that, Jen, on our last two times ago. So the 6 elements of sexual development in early childhood, and we move, and our sensory sensate development and our movement development is going. But in order for us to develop further and expand out our movement development, we learn emotions. So emotions are the first language that we learn to speak and express through moving. And there's a reason for that. And we, to not be so woo woo, it's, have you ever been excited and just not moved? Have you ever been happy and not moved? Have you ever been angry and not moved? When you see, there was a psychiatrist, I forgot his name. I think I have it here. It's like one of his, Dr. Paul Ekman. In 1958 to 1985, he studied body language and gestures and expressions in order to identify, 7 main human emotions as umbrellas to all our other feelings that come from emotion. So people mistake feelings and emotions for each other. Emotion is what's going to generate movement. So emotions do move in your body, and if you don't move them, you're going to end up with elevated stress levels and an inflammatory response to that.
yeah, for sure.
And sorry, Sarah, could I also say that that's probably a good part and parcel for the autoimmune issues?
For sure. Autoimmune is basically when your healthy tissues attack themselves. So I was diagnosed 2001 with an autoimmune disease. That the metaphysical, aspect of that is when you deny, suppress, disown certain emotions, that you've abandoned part of your language, part of your core identity, and it doesn't go anywhere. So it builds up, and that's where the term "it eats at you" comes from. It eats at you. And it literally does. It goes into every cell, every fiber, every tissue of your body, and then the body begins to attack itself because they're not moving. It's not going anywhere. They have to go somewhere. So that's just a very simplified, kind of basic description of how autoimmunity is connected to emotions, which, by the way, 85% of autoimmune patients are women.
Mm-hmm.
Just putting that out.
But and then you put in the other stress factors, like what Zach was talking about the ingredients of the food that we eat is not, like your body can maybe think of that as a foreign object, and it starts to attack it. Mm-hmm. It causes more burden on our organs.
Yeah, so like the glyphosate in all our food, if we drink alcohol, like, there's a lot of, you can find a study that says alcohol is good for you and it makes you live longer. And as many studies that'll say, like, it's literally a poison, your liver doesn't like it. And in women, women have, I think it's men have higher numbers of liver enzymes to break things down. Women do not. So the liver shoves it out as quick as it can, because it is registering pharmaceuticals, chemicals, alcohol, drugs, things like that as toxins, but we can't get it out as quickly as men can. And so, again, that goes back to our inflammatory response, why our inflammation lasts longer, why we have higher levels of chronic inflammation and autoimmune disease. It's because our liver's not processing it at the same speed as males can process toxins, chemical stress, and things like that. I talk about this in the course too. The Ambien is a pharmaceutical drug that it took them 20 years to try and figure out, why are women experiencing higher levels of accidents and mortality while on this medication. And it finally came out that, after 20 years of car accidents, sleepwalking off of balconies and stuff like that, women do not have the amount of enzymes in the liver to process it out. So the Ambien, which was being prescribed at the same dose as men, was staying in women's systems longer. So they were having a longer effect of the medication. So again, when we look at stuff like this and how we've only really been implementing regularly, still not at the numbers we need to, women in studies since 2016, it's just, 10 years, we are just now catching up in terms of the timeline of science. And we're just now catching up and figuring things out. And some of the stuff that's coming out on this is really alarming. And so, it goes back into vaccines too. There are certain times in a woman's cycle where, getting a vaccine, women have, because of estrogen, more innate immune responses to vaccines. So if we're getting a vaccine in phase 1 or phase 4 of our cycle, we're not experiencing that. We don't have the estrogen to support that. And so that can also explain autoimmune responses or activations post-vaccination. So it's, again, they're, Frontiers of Immunology, the publication, the research publication is looking into, they have 2 or 3 studies now ongoing right now as we speak in terms of tailoring vaccination and immunizations for women and females specifically because of that. So it's really, really interesting. And again, we're here to talk about the differences in muscles and joints for training and to prevent injuries and chronic pain. But as you can see, there's just so many variables that go into making women unique. And also, understandably, that is why science doesn't like to use female participants, because it is expensive and it takes much longer and needs more funding, because when you add a female or a group of females into a study, we present way more variables in order to level the playing ground in terms of data collection and understanding the results of that data. And so, yes, understandably, it takes longer, it's more expensive, it needs more funding. And on average, researchers get about 10 to 12 weeks to complete a research study. That's the average. And you can't do that with women. I mean, you may be able to. That if you could get a 12-week study, you could factor in 3 different menstrual cycles. But then what if they're premenopausal? What if they are menopausal, postmenopausal? You got to factor in that stuff too. And it's a lot, but also it shouldn't be dismissed either. So, yeah. Anyway, back to the core.
Yeah, no, for sure. Yeah, that's got to be a lot more challenging, because you basically have 3 sets of individual cycles to sort through versus just one that, I know men's hormones do change somewhat, but it's not even close to the same degree that women's do. So it's a lot easier just to look at, 3 straight months of a guy that's just, pretty, level.
Yeah.
Versus not just a menstrual cycle, but you have to do 3 of them.
Yeah.
So it's like, was there something that changed in between the first and the second and the third? who knows? But
Yeah, yeah, it's a lot. It is a lot. And again, if you're including women in a study, they should be within similar age ranges. And then you have to like divide out who's on oral birth control, who's not, what medications they're taking, because medications affect women differently. There's a lot you have to, and so just even finding women to be in these studies, I can see the complication. The complexity of it is valid, but it doesn't make it like something to dismiss either, because we're all part of this human race and we all need to understand ourselves, our bodies, and how we function. And again, women, I'm not trying to be like, wah, wah, poor women, but it is a struggle. And it doesn't have to be, though. It doesn't have to be a struggle. We can actually, by understanding all of our differences, use them to the advantage. So, again, back to the core is like, how does the core, Zach, if you could kind of go into that, considering women have longer torsos than men, in addition to greater joint and ligament laxity and all of that, how is the core creating stability, and what is required in a unique way for women to create that stability, just to support movement? You talk about that a little bit?
yeah, for sure. So um, when we think about the core is basically if I just chopped all your arms and legs off, uh, what's left is essentially the core. So it's essentially the system of muscles that stabilize your spine, your rib cage, your head, and your pelvis all together. Um, so it's also the house of pretty much all of your organs. So it's really important that it works properly. So the core is basically the foundation of all movement. Um, so when we think about a movement, um, the core needs to be working in order to stabilize the joints together so that they can move properly without going out of what's called an optimal instantaneous axis of rotation. That's a very lot of word salad, but basically what that means is your joints have a way that they work the most effectively. So they sit together and join together in a way that when it moves fluidly. There's enough space in the joint. Things aren't knocking together. There's everything. It's kind of like oiling the engine in your car. It keeps everything moving nice and good. And there's certain tolerances in an engine that make sure like the pistons have a tolerance that if there's gapping in there, the engine won't work as right or won't work as well. It's the same thing with your joints. There's tolerances in your joints, and there's a space in your joints that make it so when you move, everything works together really effectively and smooth. And your core is essentially responsible for turning on the stabilizing muscles and then turning on the big phasic muscles that move a joint effectively without it leading it to it wearing out prematurely. So when you have all the things we just talked about, any kind of stress that adds up, particularly like dietary inflammation is like probably the most common one. Uh, what that's going to do is it's going to send a signal to your brain, hey, the organs or our glands and the body's under stress right now. We don't need to use muscles as much. Our muscles need to kind of take a back seat so that all the blood and resources can go to wherever the stress is in order to heal it. And when that happens, it typically tends to turn off those muscles. And when you turn off those muscles, particularly the tonic ones, the joint's not going to be nearly as stable. And then chances are you're going to over rely on the bigger phasic muscles to move that joint. So it's kind of like, it's like if the joint's not stable and then you try to use big muscles to stabilize and move the joint, it's far more likely to move in a position that it's not supposed to be in, and that can create extra wear. So more or less, inflammation and stress is going to increase the chance of joint pain later. And, given what we've been talking about with women having increased laxity already, longer stress times already, and then fluctuations in their menstrual cycles, which can completely change how a woman, has stress in her, her body and the way that she moves her muscles. Um, yeah. If you don't take those points into consideration, then you can set yourself up for, it's like you said, a lot more, 8 times more ACL injuries for all those factors I just mentioned. Because it's not just the biomechanics that lead to an ACL injury. It's all of those other factors combined, on top of whatever training program you have that's going to create that stress on the ACL that's eventually going to lead it to
Right. Yeah.
issues.
And if you're a coach or a practitioner or any kind of provider, but especially coaches and trainers, think the number is like 80, somewhere like mid 80%, 80% or more of your clients will be women. So it is really important. But let me throw this out there too. This is just another thing. Women who have had children before and after their abdominal muscles. So obviously our muscles have to spread apart and lengthen and stretch in order to support the growing torso in our bodies. And then after pregnancy, a lot of women do end up with diastasis recti, which is the the center down the down the center of the core. Basically, it's like a separation of those muscles, and the rectus abdominal muscles sort of split apart. And so let's talk about that for a second. That gets even more complicated. A lot of women have it and they don't know it, but there are degrees of severity. I know, if you're a woman, you're laying on your back and you come up, you just lift up like you're doing a sit up. If you see sort of like as you're oh yeah, I'm mirrored. As you're coming up here, if you see a dome come through the center here, if it, instead of going inward like you see in mine, if it comes out, then your muscles are split apart. The severity is like 4 to 5 degrees. That means that the only thing keeping your organs from popping out is that sheath of fascia in there. And so it's really, really important. But even if you don't have that dome, you could have diastasis recti, the separation. And so a way to test that is, is to, if you can get 2 or more fingers in between the muscles, you have diastasis recti, even without the dome. It should be about 1, in between those recti muscles, or less. So yeah, when you talk about that, how do you imagine just having this diastasis recti, even if it's not to the degree of that image on the right, which is like 4 to 5 degrees? A lot of times you need surgery to repair that. But how does that affect stabilization? Oh, you're muted.
Yeah, so when we look at that picture, it's showing the abdominal wall. Any kind of tear or scar or um, physical disruption in the way that the fibers move and glide together. To the degree that you have that going on, it's going to make uh, activating those muscles more challenging. It's kind of like, if you look at a spider's web, like a beautiful spider's web, and you were to kind of slice a certain part of the spider's web, the whole spider web is going to change, based on what you did to the other parts of it. And then if you imagine that as like your core and it being able to move properly, a perfect spider web, might move together really, synchronously. A perfect core will work together really well together. But if you throw a big, split in the middle of your abdominal wall there, it's not going to turn on as well. The rest of it kind of has to. It's like having a trampoline and you cut a hole in a trampoline. You see the slat go out of the trampoline. It's kind of the same thing with your core. So the diastasis recti, unless it's unless it's managed effectively and rehabbed effectively and strengthened back together, your core is going to constantly have extra slack in it from that split. And that goes the same with scar tissue. Trigger points and muscles can really shut down a core, and that's not to mention the inflammation and things like that we just mentioned. So
Yeah, and if you have you can't recruit the core muscles synergistically to create stabilization, then you'll depend on all of the back muscles
mm,
to stabilize you instead. And the rector muscles of the spine are also significantly smaller in women as well, again, to create more movement and laxity in the spine. And so, yeah, you may not have an injury, a back injury, but you may be experiencing some severe pain, chronic pain in your back if your core muscles are not turned on. Very common in women postpartum. I mean, they did a study in the UK on this, and up to 20 years postpartum, women were experiencing this because they did not have their core muscles were not synergistically repaired back together through proper movements.
yeah, I'll share a story. One of my had a man, wasn't even really practicing yet, but I was in massage school, and another student, she had had 4 kids, back to back to back to back. So 4 years in a row, she was pregnant with 4 kids, and she never did any work to rehabilitate and strengthen her core after uh, she had 4 kids. And I don't remember. She walked up to me and she was saying, "Oh, I had this SI joint pain or low back pain," and she couldn't bend, basically to get her arms past her knees. Like even with her arms hanging, she would try to bend and she just stopped and she couldn't get further than that. And it was, I think, causing a lot of stress in her low back. And she was, like I've been dealing. I was like, "How long have you been dealing with this?" And she was like, "For years, like since I've had kids." And so uh, I just realized, oh man, she's never re-strengthened her core after giving birth to 4 kids, and I basically gave her a really simple uh, TVA exercise, um, and which is like the weight belt of your core. Like it's the first thing to activate to keep everything stable. It's part of your what's called your inner unit, and I just told her to go home and do these TVA exercises. And I think it was a day or two later, uh, we were in the same room, and she came up to me and she had this big smile on her face, and she was like, "Zach, check it out." And she just straight legged, flat down, touched her hands to the floor, and she was like, "No pain. I can touch the floor. Everything's fine." And she was like amazed at it, and I was pretty amazed too because I was a lot younger and I hadn't worked with as many people at that time. Um, but that one always made me smile. I always remember that one because it's like, man, she'd been dealing with this problem for years, and after having kids, probably no one ever told her, hey, like we need to re-strengthen, all that stuff that got stretched out and widened and made more lax as a result of your pregnancy. We need to draw all that stuff back in and get everything back together again so that everything moves together effectively. So she was pretty excited about that, and yeah, I'll never forget that story. It was a good moment. But it just goes to show, like, postpartum in particular, but women in general, but particularly postpartum, after things have been stretched out like that, like women are already they have a tendency to be more lax, and pregnancy only makes you more lax. So if things are really yeah perfect.
Yeah.
If you're unstable, look how much your abdominal wall and your core muscles are being stretched out there. After you give birth to a kid, they might appear to kind of go back to normal somewhat, but they're not strong and stable like they were. So for postpartum, it's really, really, really critical to have inner unit core training. So just deep core strengthening and deep core stability to get that back first before you jump into doing anything crazy. Because I would imagine a lot of women, after they give birth, things are kind of stretched out. Maybe they put on some weight. After once they everything's good with the baby and they have some space to do it, they might go, oh, I need to lose this baby weight, and they jump right into a CrossFit class without considering, um,
They
you know,
want their tummy back.
Yeah, exactly. So
their body back.
they don't train that core first and make sure everything's strong together, and then jump into something where they have to move a lot of stuff that requires a lot of stabilization, but they don't have the stabilization.
Mm-hmm.
Yeah,
And they have
up for injury.
neuromuscularly like trained their back muscles in the spine to be the stabilizers for 9 months.
Mm-hmm.
So just on a neuromuscular level, even when that baby comes out, you're still activating the spinal muscles to maintain balance and stability. So you have to retrain the core to become stabilizers, collaborative stabilizers. So like the TVA that as you were talking about, that TVA breathing, a lot of times for women, if you watch my back, what I'll see is when they're trying to draw their TVA in, you'll see the spinal muscles will activate. And so those will, when they're using their back muscles to activate the TVA, that means that they aren't actually bringing the TVA in. They're using the muscle to draw the belly in. And so you have to retrain the TVA to draw in without relying on the back spinal erector muscles. And it's hard. And you can see a lot of times I've worked with women. I know when I first learned this and I was training my muscles, it wasn't until after my third pregnancy that I learned about this. And trying to do that, especially with a practitioner like my husband, Alex, who's like, has his fingers on my spinal erectors. He's like, nope, you're using your spine, and trying to just on a neurological level get those core muscles, the deep core muscles like the TVA to activate can bring out a lot of emotions once again. So maybe we'll do a video on that at some point on how to draw that TVA in, because how many times have you trained a woman to drawing in the TVA and she has not emotionally responded to that?
A couple of times. Yeah.
Yeah.
For sure.
I would say at least 3 out of 4 times that has happened to me. And even when we had check level 3, level 2 courses at our here at our facility, the students who are like check practitioners are very high level practitioners. I mean, they know things about the body that your chiropractor practicing for 30 plus years know. And so just I wanted to set that out like as a baseline. These practitioners that are coming into these level courses are high level what they know about the body, but as students, even watching them try to learn it, the thing is, through the Institute, you can't teach it. They won't certify you. You don't get your license unless you yourself can do it. And I have witnessed many times in those courses, the female students who are just high level practitioners are demonstrating getting that TVA activated, and they get hot, they turn red, they start sweating. A couple of times I saw them crying, having to leave, take a break. Again, because that TVA, and one time it was a woman who had never even had kids, like, because we're so used to wearing high heels, we don't realize what it's doing to our core and doing to our posture. So if you look at the woman wearing heels, and those aren't even tall heels, like if you're gonna wear heels, like go big or go home. I mean, 3 inches. What is this? Like 1.5 inch heel. But even with a 1.5 inch heel, what that does to the pelvis and tilting it forward, which then creates more of a curvature in your back and elongating your abdominal muscles. And then on top of that, women wearing heels, forces the pelvic to tilt. So then you have to come back to balance that. You're on these heels, but also women suck their belly in to look skinnier. They want to suck it in, right? And so you're creating so many postural dysfunctions just in that, and improper breathing mechanics. Again, it's not getting oxygen to the organs and the soft tissues and the muscles and the ligaments that need that oxygen. Which also, if you suffer IBS or constipation, chronic constipation, if you're not pooping at least once a day, and you're a woman, consider it could be the high heels. because again, you look at the woman who's not wearing high heels, and in the lower abdominal, that's your large intestine, that's your colon, that's where fecal matter moves through. And when you're wearing heels and you're training your posture, like the image on the right side, you're reducing the amount of circulation, blood flow, and just room for your large intestine. And so kind of went on this whole tangent, but that TVA is really, really important in drawing it in. It's all about bringing, if this is the back and this is your belly button, you want to draw the navel in towards the back, towards the spine. And if you can't do that without activating the muscles in your back, then your TVA is very weak. So you want to keep doing it as much as you can until you're able to draw it in without activating the back muscles. And it is hard. Yeah. But if you have low back pain, that's the thing to do.
Especially, it doesn't get taught very much.
No.
You don't see it taught very much in gyms and exercise classes and that kind of thing.
No, I mean, even in yoga, where you do use a lot of TVA activation to do yoga classes, they don't really talk about the TVA. And Alex and I kind of joke how many yoga instructors we've had as clients that also didn't know how to breathe. It's really, really important. Again, we've covered a lot. We're like, we'll keep it under an hour. I don't know how you do that when we're talking about differentiations between male and female, joint stabilization, muscle recruitment, core inflammation, stabilize, all that stuff. And Zach, would you agree? Like, we haven't really covered it all. And so again, it just goes to sort of illustrate again, like how important this stuff is. Is there anything we didn't cover that's probably really important?
Exercises? Yeah, I was going to say exercise selection and exercise variables.
Yeah, let's just go into that real quick. And I know Jen, she may have to go, but what would you say in terms of like, the muscle inequality, the joint ligament differentiations, all of the variables that we added in there, including the hormone stuff, like, how is certain pain or, range of motion limitations and things like that playing into women specifically? And like, what are like 5 of your big bang type exercises that you would prescribe a patient?
Yeah. So, as a general rule of thumb, whenever you're designing exercise programs, you want to have mobility first. So you want to have flexibility and the ability to move through a full range of motion. And then you want stability second. So the ability to stabilize that joint through the full range of motion. And then you want to add strength. So strengthening all of that. And then you can move on to power, which is turning that strength into combining it with speed to create, more force. If you jump into power without those first 3 things, you're just putting a lot of stress on joints. So for women, given all the things that we've talked about, but this is just true for people in general, is you want to start on mobility and stability first, particularly with women, because if they're, more joint laxity, less tonic fibers, more stress, cortisol, things like that, changes in menstrual cycle, focusing on keeping things mobile and stable first are going to be really, really important. So that's all. It's going to change throughout the menstrual cycle. And Sarah, you'll know more about this stuff. But making sure that you have stability exercises on hand and that you can master first before you jump into anything strength-wise and power-wise is going to be really critical. So 5 exercises, I would say, that are going to be really good for women. One is going to be the 4-point tummy vacuum. That's
TVA.
probably number 1. Second, I would say horse stance series is really good. That's going to really help stabilize the shoulder and hip girdles, as well as using your core when you're breathing. So horse stance, TVA horse stance. Let's see, lower abdominal series. Uh,
Yes.
that's like, that one is money for any kind of hip, low back stuff going on. Strengthening those lower abdominals, which turn off on people all the time. When you sit down, they kind of tend to go lax. They don't get used a whole lot, especially in sitting down using computers. So after that, I would say prone cobra, which is going to help strengthen those upper back muscles and the external rotator muscles in your shoulder. So we were talking earlier about, having that kyphotic pattern, yep, having that kind of rounded upper back pattern. You see, like dowager's hump, you see in older women all the time because they walk around like this for years and years and years, and that's just an adaptation. Prone cobra is working all the muscles that get lengthened and weakened over time with that rounded, shoulder and, rounded thoracic spine. And then number 5, I would say, given that you can learn to do them properly, I would say inchworms. It's a infant development exercise that works on pumping the spine and using all the muscles of the spine to move the spine, but also stabilize the spine while it's being moved. So that exercise turns on all these little tiny muscles in your spine that work to keep it, in line with each other. So if you're, these are great for pretty much everybody. I haven't met a person that doesn't need these to some degree, especially doing them, right. But if you're a woman and all you had was 5 exercises to do, these would probably be the best ones to start off with. Um, with any kind of program, and in any phase of your menstrual cycle too, because even at your
Yeah.
worst in menstruation, when everything's low, everything's more inflamed, there's less stability, you can do these exercises safely in menstruation without issues. Now the inchworm, that one's got to be trained a little bit, just to make sure you're doing it right. But once it's done correctly, it's like magic. And all these exercises are great for any time of the menstrual cycle, and they will help build a foundation. So when you have more energy, you have more stability, your hormones are a little bit more balanced. It'll give you a better foundation to add on a little bit more difficult stuff to that later. So when you feel more spiky and like, oh, I want to go get a tougher workout in, you've kind of created some stability in front of that, so you're less likely to jump into something that's gonna hurt later.
Yeah, I agree. So we have the 4-point tummy vacuum, the horse stance, the lower abdominal series. Those are brutal. I mean, it's not a workout like when you think of workout, but the next day, like, good luck, like, coughing or laughing. Then we've got prone cobra and then inchworms. I got those right.
Mhm.
Yeah, and if you want to understand more about those exercises, how to do them, I mean, these are very specific. It's sort of like a blend of Feldenkrais movements and all these other things that they've blended together and incorporated into the Czech training. And so when people think of inchworms, they think of, like, when I played soccer or softball growing up, you're standing up and you touch your toes and crawl out. That's not the inchworm we're talking about. But if you want to learn more about these, definitely go to members.bodybuildinginstitute.com, get into a membership. You're going to have, like, all the, instructions, the videos, the office hours, the peer reviews, you have access to all of that. And like Zach said, you can do these exercises anytime throughout your cycle without being at a disadvantage. But I would say, like, during mid-cycle to mid-luteal, these are great exercises to do as prehab, like before you work out, because they get you stabilized. They activate, your motor control, your stabilizing muscles, your your neuromuscular motor control gets activated with these exercises. So if you do these exercises, you could even just pick a couple of them prior to a workout, doing deadlifts, powerlifting, any sort of power movements, any of that. You've activated the stabilizing muscles and your neuromuscular motor control. And so it's always a wise move to do that. And so a couple of exercises that I also believe are really big bangs for the buck, we're not talking about prehab and stabilizing, is the sumo deadlift. For women, I believe that activates all the muscles in all the areas where we have strengths, as well as recruiting some of those areas where we may have vulnerabilities and weaknesses. It's a full body movement that builds on your strengths and as well as recruits what is weak at the same time. So you're creating this collaborative effort to turn everything into stronger and strong. So it's as a simple way to put it, I guess, the sumo deadlift is perfect for women, especially if you can nail that horse stance. If you can nail that horse stance, I would let you go into a sumo deadlift. But if you can't, then again, if you don't have activated core muscles, if you can't activate the glutes because you got such a terrible anterior pelvic tilt, then you're going to be doing a neck workout, basically. You're going to be pulling that. If you see people, especially women, who are doing that horse stance movement, or not the horse stance, the sumo wrestler, they always like look up as if their neck is going to pull them up. And then you get neck injuries. You get lots of terrible pain, inflammation, things like that. If you keep doing that over and over, you're going to end up with it. But if you can do it properly with the proper form, I say the sumo deadlift is an amazing big bang for your buck. If that's the only thing you do throughout your cycle in terms of weightlifting, building strength, you're going to do great. You're going to be fine, especially, as you get into your 40s like me. You want to build and maintain muscle to support the bones. And so definitely that one. And then I would also add in, once again, if you could do the horse stance, with that dowel rod, and you can keep proper form, it would be the bent rows. Again, because you're pulling yourself back. Women who tend to have this, you want to strengthen the upper back muscles to help bring yourself back. You really want to train the upper back and your shoulders to move back. And again, if your pecs are sore after doing bent rows, that means you're doing it improperly. But I've also had women come to me who wanted to get breast augmentation, or they're upset because their boobs are sagging post, breastfeeding and things like that. If you can get proper form doing bent rows, what that does is it strengthens the muscles in the back and it shortens them. So when it shortens the muscle, it brings it back, which then lifts the breast. And so I've had that I can remember and count on 3 clients just at the top of my memory where we trained that. And they were like, so they don't need to get a breast lift or breast implants because it literally pulled their breasts up. So those are 2 that I always love for women. But I also agree with your rehabilitative and prehabilitative exercises. Those are, I agree with those 100%. So again, if you want to learn more about how to do those exercises and what the movements look like, you're not going to find them on the internet. I could be nice and just be like, you could go to YouTube and look up Paul Chek. He may have some of those on some videos on there. They may be pretty old. They may be going back, 10 years or so, but you could look them up if you want to. But if you want to learn more about those and go even deeper into a lot of the stuff we didn't cover, a lot of the nuances, you're a coach or a trainer, practitioner, provider of any kind, you want to learn more about these differentiations, just again, go to members.BodhiBuildingInstitute.com and join Zach and Jen and me every week, as well as other Czech practitioners. And we have master Czech practitioners on there, ready to answer your questions and do some peer reviews and yeah, move us forward. Anything else, you guys?
No, that's great, Sarah. I wanted to say though that this is a lot of information. So for people that are kind of new to this, it might be beneficial for you to come even just join our free membership at BodhiBuilding Institute. But we also have a membership where people can come to our office hours. So every Monday we hold for 2 hours, sometimes 3, office hours where anyone can come and you can ask any question. So there's lots of practitioners there. Sarah and Alex host it. And, you know, it's a great way to learn more about yourself and how you want to improve your health, no matter what that is. You know, it could be relationships, could be business related. There's a really great, you know, group of community of people on bodybuilding.
Yeah. I mean, in our office hours, you know, even if you're a new member joining office hours, you have access to, you know, over 500 now full-length video replays of previous office hours that you can search keywords to find, like, has someone asked this question before? And you can listen to practitioners and coaches really dive in deep on these. And so it's like, as you can see, and, you know, if you zoom in, there's so many, like how to read an MRI, the differences in, you know, different vagal nerve exercises for certain pain, understanding how to incorporate and know your core values in terms of reaching goals. Like, we cover like just so many different topics, wide range. So if you're looking for something specific, you'll find it. If you're looking for a broad range of topics, you'll also find it. Yeah. Office hours is fun. It's my favorite. Yeah. All right. Well, we'll see you guys next week. We're going to talk about breathing. If you're watching this as a replay, we probably already did it. You'll want to check that video out too. This is going to be fun.
And I just wanted to thank Zach again for coming out, and we'll definitely be having you back, Zach, because you're very knowledgeable, very experienced, got lots of clinical work behind you. So thank you so much.
Yeah, absolutely. He may come in for the breathing because, again, that's something he works with in patients quite a lot. So, all right, we'll see you guys next week.